All right, so surgery time. So, like I said, Dr. Lazar came in and did a discussion related to the rationale of why the surgery needed to happen, explaining all of the procedure, etc., and showing me an example of the stent. So, of course, um, the anesthesiologist comes in and does their bit, goes over medical history as well. They roll me back, and like I said, I asked not to be sedated, so you can tell that they are normally used to somebody that's not really with it, because I tried to help them put myself from the gurney onto the surgical table, which they all freaked out about. It was pretty funny. So they get me onto the table. It's a surgical room, so therefore it is cold. Uh, of course, you always have to be naked, blah. They bring over all the sterile stuff because it is a medical procedure, so it is sterile. So there's a sterile field. So they put that on you. And prior to putting all the sterile on, they have to scrub you with some unpleasant iodine uh, staining concoction that I still have some spots on my skin that I cannot get out to save my life. So they scrub you down and then they put the sterile field on top of you. And like I said, I'm conscious through all of this. So they're getting me all ready. They're having fun. I am, of course, the last patient. So I am standing between them and home. So they're all basically slap happy, which is really fun to witness. Being in the medical field, I can relate. um, so they have to get all of their equipment ready, and they have me all ready for when the surgeon comes in, Dr. Lazar. So he comes in and they just do local numbing on my groin because that's where they're going in to put the stents in. So what they do is they put a wire that has the stent that's not inflated, and then there's a balloon that inflates the stent when they get it to where it needs to go. So they put 2 incisions in my groin, and because I'm on the triple anticoagulant therapy, I did bruise quite significantly. So I actually feel it when they inflate the stent, and it puts quite a bit of pressure on my back. And we're going to talk about the rest next time.